There are still many uncertainties about COVID-19, but one thing we do know, and that is contact tracing and testing is very important to keep this virus at bay. We have invited two scientists from the University of Texas to shed some light on these important tools in our arsenal. Talk about why testing is so important and how it goes hand in hand with this contact tracing.
So I think testing is really critical with this particular virus because we don't know how many people are or have been infected with it. There clearly are people who have had the virus who have been able to spread the virus but did not themselves have symptoms. And unless we know who's infected, we don't know who they have spread the virus to or who their contacts are. And so the testing is particularly important with this disease.
And Dr. Felkner, tell us why contact tracing complements, enhances the testing, how these two work together.
Well, the first thing that we do in contact tracing, this first step, is to identify the cases. And then those cases can be contacted and instructed in how to isolate. So we've all heard on the news about how to isolate, but I think it's an entirely different thing to find out that you are infected and now you really have to implement those things that you've just heard kind of superficially in the media. So that's the first step in the quote contact tracing, is identify the case and give them good instructions about isolation. Then because COVID is communicable during its asymptomatic period or pre-symptomatic period, that's where the contact tracing is especially important, because you then ask the case in the last few days. I think most people are using 2 days prior to symptom onset, so that could be almost a week before you're talking to them, saying, beginning from that day, who all have you had contact with? And you should explain to the person what you're defining as contact. So just passing somebody at the grocery store checkout is not really considered a contact. But if you spent, some people are using 30 minutes, some people may be using less, or some specific amount of time with a person in close contact with them, then you give their name, the case should give their name and their contact information. And then they can in turn be contacted, warned that they have been exposed, told to quarantine, and given somewhere to call so that if they do become symptomatic, that follow-up can be done immediately.
How are we doing with getting more tests out there? I read that someplace like Austin, the city the size of Austin, would need about 2,000 tests a day to adequately judge the data.
So we have not done sufficient testing thus far, and the criteria for testing have been very stringent. You needed to have symptoms that were really fairly clearly associated with the typical cases of the virus. And in retrospect, I think this was not the best approach because many people didn't have a sort of classic set of symptoms of respiratory distress, fever, muscle aches. And a number of people were not identified as being infected and were able to spread the disease before it was clear that they did in fact have the infection. We need to be testing a much wider range of people who have different symptoms that may be indicative or may not, people who have been in contact with cases that may not have been adequately identified early on. And wide-scale testing will identify people and allow us to do contact tracing in order to find out where the spread has occurred. But we're just doing far too few tests to really know the numbers and the extent of the infections in Texas.
This is a delicate balance between trying to get people back to work and help the economy and also protecting people's public safety. What gives you pause as scientists in the public health and infectious disease arena about reopening, so to speak?
I think the thing that I'm most concerned about is that people will interpret the reopening as meaning that the danger is past. and they will not continue to observe social distancing and other practices that are important. And I think we have to find a way to convince people that we can't simply go back to normal right now. We still need to be wearing masks, to be practicing social distancing, and to really being attentive to what's going on.
Dr. Felkner?
I think, again, if you are ill, don't go to work, don't go out in public, don't wait till the health department calls you and says you have a positive test. Be proactive and responsible. Another thing that I think is important is that there be no stigma. Sometimes we say, oh, well, they didn't follow the rules, they didn't wear a mask, or they didn't do this or that, and they got the disease. No, we get the disease, we acknowledge it. We don't want people being afraid to acknowledge that they have the disease. We want them to say, I have the disease, and I want you to know that I have the disease so that you can in turn protect your friends and family.
Dr. Marilyn Felkner, Dr. Shelley Payne with the University of Texas, thank you so much for joining us and shedding light on the importance of testing and contact tracing as we try to get a handle on COVID-19.
Thank you, Judy.
Thanks for having us.